So I'm going to go over some cleaning instructions for the night guard. It is pretty simple. What you want to do is use soap. Either use hand soap or just soap. You do not want to use mouthwash or toothpaste. That is for your mouth, not for any appliances. Soap or just soap. You're going to put a small drop inside of the night guard and you're going to scrub the inside of it and the outside of it every morning when you're done wearing it. Do not use hot water. This is a rubbery material, so it could change its form from using really hot water. It's best to use cold water, but room temperature is fine too. After you're done rinsing it out, the night guard case that we give you has holes on it, the top and bottom. You want to place that in there and it'll air dry. If you want to leave it out, that's fine too. You just want to make sure that if you have pets or kids, you put it in a high place where they cannot reach it. We've had patients, their dog or cat has bitten it a little bit. It is a rubber material. Again, some pets think it's a toy. If you want to leave it out, you want to make sure that if you have a bathroom where the window has the sun hitting directly through, that it's not left out on a sunny day, because the heat can cause friction and heat up and change its form. Another way of cleaning it is using denture tablets. The little tablets they sell at CVS or Walmart for your dentures and partials. You want to put that in water, let it dissolve. Make sure it's room temperature before putting the night guard in there. It's not necessary, but it's just an extra way of cleaning it. You can do it every night or every other day or every other week. The color does change over time. You start to see a yellowish color, that is normal. Saliva has been sitting in there for a long period of time, it does happen. Now if you see brown or yellow, that's where you should be concerned. Bring it in, we'll take a look at it. That's everything when it comes to cleaning. You just put it in your case and you put it on. Now to wearing the night guard, it's new to your mouth. Your tongue, your cheek, your lips, everything has to get used to it. Some patients can get used to it right away. Other patients, it takes a little while to get comfortable wearing. You want to be consistent wearing it every night. If you try to do one night wearing it, the next night not wearing it, it's just going to be a longer process for you wearing it. So for 2 weeks straight, try to wear it every night. If it's more than 2 weeks and you're still having a hard time wearing it, bring it in, we make an adjustment. Having some pain in the back of your jaw is very normal for the first couple days. It's new pressure being put on something, so that is normal. If it's more than a week and you're still having soreness in the back of your jaw when you wake up in the morning, bring it back and we make an adjustment. We make a few adjustments before we decide the night guard is just not for you. So don't just come in, we make an adjustment and you think, oh, there's nothing else you can do for us. We make a few things before we decide it's not for you. It does happen sometimes where a night guard is just not the option and we figure out what we can do next. But majority of the time, most patients can wear the night guard after we make the adjustments. The last thing is when you come to your cleaning appointments, we want you to bring them to your cleaning appointments. We take measurements to see which side you're grinding on. Most people grind on one side more than the other. And we also like to keep track of how much is left on the night guard. The average night guard can last 4 to 5 years. If you're a severe grinder, then it can be 1 to 2 years. So we just want to make sure that we're all on the same page and no surprises, and you come in one day thinking everything's fine and we tell you you need a new night guard. So we just like to keep you informed of what's going on.